is that the open shop worker, the contractor is that just set a level that he will pay, and the worker has to pay the rest. And what do you think happens? These workers making what we title substandard wages do not elect to pay for the coverage for themselves and their family, and rely in Hillsborough County on the indigent care. That's where I come to cost shifting. We have known it in our organization for years. There's a thing called cost shifting, to where the premiums that the hospitals and the providers charge us are actually inflated to offset those that do not have insurance coverage. Now that's not fair. And a reform that would put this all back into perspective is probably, as most level-headed people would see, is a matter of fairness. But we're having to pay for those that don't have it. And again, in construction, local unions, where we have contractors bidding on a competitive level to try to compete in those levels, it's very difficult. Very difficult. So the cost shifting is something that I never could understand. That's not fair. And let me just say this, I did this one time. Years ago, our plan didn't cover chiropractic. Now, I'm not one that goes to chiropractic. I've been fortunate. I'm not like Mr. Bowers. I had my first, when this WellCare came out, I had my first physical since the 4th grade. Kind of dumb, I know. But I knock on wood, I've been fortunate and been healthy. But I had this problem with my neck, and I couldn't look as hunting season was coming, and I couldn't see to the left as far as I could to the right. So my wife, who I listened to, said, you need to go to a chiropractor. So I go to this chiropractor, but we didn't have coverage. So I walked in there, and this first thing they asked me, do you have coverage? I said, no, I don't. Okay, that would be $25. I went again, and by this time, believe it or not, our healthcare had that coverage. And I said, I got insurance now. Well, pay me $10 copay. And as a trustee, when they came back, they charged my fund $80. So they got $90. This is not rocket science, but something's wrong with this whole mix. There again, going back to the universal health care, a national health care system that has responsible controls on cost. So again, from a construction standpoint, that's what we're faced with every single year. We have to watch the level of benefits. If we don't get the increases during economic downturns and the costs go up, we have to reduce benefits to our participants. Again, in construction, we have what is known as, in our system, we have what is called a contribution bank. Those workers that continually work, they meet their premiums for that quarter. Any excess monies goes to their contribution bank. And what this does for a construction workers generally don't work 12 months out of the year. So during that interim period when they're waiting on the next job, there's a bank of funds set up in his name that he can draw from for qualifying quarters to keep his wife and his family's insurance intact until he gets the next job. To where in the open shop dealing with these workers, a lot of times they get single coverage for themselves. Some employers do that. Some have no access. And if they leave employment at the end of that month, it's over with. And of course they've got to go to COBRA, which all of us know is very expensive. So that's what we're up against each and every day out there in the market to try to be competitive. It's very difficult, and I hope it changes. I really hope that, I know that the President and the Congress, they've got a serious task in front of them. I was one of the ones fortunate enough to sit when Hillary Clinton came to town talking about the health care. She's a very, very smart lady. And I watched that at the Performing Arts Center, watching the various walks of life, not only from patients to providers, and they asked the hard questions and they discussed those things, and I could tell she had a tough task, and we didn't get that accomplished. So I know President Obama's got his hands full with this, and there are no one, I don't think there's any one solution. But again, I think meetings like this, making sure that we identify all these issues, these problems, hopefully some of them can be touched on, and we can come up with something that's comprehensive that helps the American people. We know we have to pay for it, like Jody said. We have to pay for it, but a system that's not broken, that works for everybody, it's worth the cost.